Just ahead, you're going to meet a woman on her way to learn more about her heart's desire. A retired nurse awaiting the news that will change her life. A researcher at work to find ways of easing the fear of a disease that affects some 246 million people. And an old soul masquerading as an 11-year-old boy. They are connected by a special place and its people. Penn State Milton S. Hershey Medical Center. Founded in 1963, committed to enhancing the quality of life, educating future generations, and discovering what lies ahead. It is a place where you will find the full spectrum of emotions, dreams and hopes, anxieties and tears. Doctors, nurses, and researchers, where time-honored values meet the latest in breakthrough technologies, with the biggest goals always in mind: to heal the sick, ease the suffering, and make life a little better when you can. It is medicine in blue and white. Krista Laszlo and her husband have tried for some 6 years on their own to have a baby. Something somewhere is wrong. But what and where? Her first exam at Penn State Hershey Women's Health gave her some answers she was looking for. She was immediately referred to Dr. Richard Legros, professor of obstetrics and gynecology.
When Dr. Legros gave me the formal diagnosis and says, here, this is how we can work with this, that was one of the best days ever.
The diagnosis, PCOS, or polycystic ovary syndrome. A somewhat silent disorder that affects up to 10% of women, generally between the ages of 12 and 45. It's a key contributor to infertility. And while the symptoms are similar among women who have it, there is no one quick fix or cure.
Once I was diagnosed, he totally laid out a plan for me. He was like, all right, here's our goal. This is the way we're gonna work it and see what works for you. Our first attack would be, we'll try pills, see if we can get you to ovulate. If that doesn't work, he's like, then we can talk in vitro fertilization.
So this is actually an ovary of a normal woman. And one thing you'll notice is overall it's much smaller.
The problem is that what works for one person may not work for another. Exactly what causes PCOS and specifically what to do about it remain a mystery.
And a polycystic ovary traditionally has a lot of stroma to it. And then what we see along the outside are these small arrested follicles. So clearly a polycystic ovary.
PCOS was first diagnosed in the 1920s. At its simplest, it is a syndrome where a female's hormones are out of whack. One of the results being that while the ovaries start the process of producing follicles each month, those follicles never turn into the eggs needed for pregnancy. The why has been the question through the ongoing decades. Where is the mistake being made? Is it the brain, the ovary, or is obesity a cause? Genetics, diabetes, too many male hormones? The studies and research continue.
Every generation thinks they have an answer, and so the first generation thought it was the brain. The second generation thought it was the ovary. The third generation thought it was insulin resistance. I guess I'm the fourth generation. I'm not sure it's any of those. So I'm looking for the answer.
And Krista Laszlo is helping him find it. She's one of his patients in an ongoing study here to test the effectiveness of certain drugs in helping ovaries produce healthy eggs. She knows one thing for sure. From the very bottom of her heart, she has never been more ready to become a mom.
It's hard because you never know if you're gonna become pregnant. And I think the hardest part is, like, you see your friends having babies, your family has babies, you just see all these random pregnant people in the world, and you're always wondering, is that gonna be me? And it's very frustrating, it's very depressing, it's very anxiety-provoking that you have no idea whether you're able to have a baby or not.
Jane Gallagher retired from nursing about 5 months ago. She's familiar with just about everything that goes on in a hospital, with the exception of what's just about to happen to her. She's come to Penn State Hershey Heart and Vascular Institute this morning to have her heart checked with a thin tube called a catheter. Dye will be passed through it in order to see the heart's blood vessels.
So the heart catheterization will allow us to take a look at the blood vessels of the heart and to see if you have any blockages.
It's a common enough procedure, but with a twist. Instead of going up through the groin's femoral artery to get there, this team will use the artery in her wrist, called a radial approach. Only 1 to 2% of hospitals in the country perform the procedure this way. And that's welcome news for Jane, who had the femoral approach procedure some 21 years ago.
When I had it through the femoral artery, I had to lay with sandbags on for so many hours. I don't really recall how many, but it was too long. Very uncomfortable to have to lay still that long. So I think this is great.
To the patient, certainly it's comfort. They don't have to lay in bed for hours to recover. There's a hemoband that compresses the artery when we're done, and they actually can sit up and eat and be very comfortable. There's also some benefits that we see as far as reducing the risk of bleeding and complications. The artery is easily accessible and it's easily compressible. And so if there is any problems, it's quickly identified.
I'm just going to tape your arm to the board so it doesn't move while the doctor's doing the procedure.
Jane will be in the catheterization lab for less than 30 minutes. Then she will learn just what's going on with her old ticker. Her words. Chances are, if it's snowing, this is the place where you'll find 11-year-old Nathan Murphy. He loves to shovel, among a lot of other things.
He does love to be outdoors. He loves to be able to build forts or just go hiking or, different things. So he's a very outgoing child and just very friendly and very happy. I mean, he's a very happy child.
Why would I do that in public?
Because you always do that.
I beat you.
When Nathan was only 4 months old, he was diagnosed with neurofibromatosis, a condition where noncancerous tumors form along the nerve pathways in his brain. Pediatric neurosurgeon Mark Diaz first met Nathan about 8 years ago. After Nathan's diagnosis, a disorder that affects 1 in 3,000 at birth, the team decided that being proactive was the best course of action. Every 6 months, Rodney or Stephanie Murphy would drive their son to Penn State Hershey Children's Hospital for an MRI, so doctors could see what was going on inside his brain. In some patients with the disease, nerve pathways will continue to look pretty normal for a long time. Nathan wasn't as lucky. This past year, they found the tumor.
I have headaches a lot. Very bad ones, too.
There were times when he was screaming in pain. I mean, there were times when his father had to pick him up and carry him up the steps because he couldn't. He just was excruciating pain. And that is so painful and so hard to see him struggling that way, and yet feeling so helpless that there was nothing we could do.
Nathan's tumor was sizable, a bit smaller than a golf ball.
In Nathan's case, we wanted to remove the top part of the golf ball and whittle it down, but we certainly couldn't get to the lower part of the golf ball because there's a lot of critical structures down there, including the eye nerves, that you don't want to remove. And it would go into
To
the
whittle
brain.
away at Nathan's tumor, Dr. Diaz used one of the newest technologies available. It's called the Myriad,
Inside of this shaft,
and it allows neurosurgeons to enter the brain through a very small opening. The device basically grinds, chews, and sucks up tissue as it's guided by the surgeon's hands.
up into the fluid pocket.
Dr. Diaz has taken as much of the tumor away as he can for now. Whether or not it continues to grow is a question of time.
For me, it's probably the hardest thing I've ever had to do, is to watch my son suffer and knowing I couldn't do anything about it, because I'm daddy and I should be able to do something about it, but I couldn't.
Following his surgery, Nathan stays at Penn State Hershey Children's Hospital under close supervision for the next 5.5 weeks. When Jane Gallagher, a newly retired nurse, noticed some irregularities in her heartbeat, she knew her best bet was to come to Penn State Hershey Heart and Vascular Institute.
Just a really good reputation, excellent physicians, excellent nursing care. I can't speak highly enough about the nursing care. My husband was in for 3 weeks, and he had the best and the brightest.
We just passed that wire into your radial artery.
Today, the best and brightest are at work, looking at her heart.
We have access. This is a picture of the patient's right coronary artery with our catheter coming down into the artery here. The artery comes down here and at this point is completely blocked, 100% blocked off.
But even though her right coronary artery is blocked 100%, definitely not good news. What Jane's other heart blood vessels have done over the years is to sort of bypass that blockage and build their own support system to keep the heart going. There's clear evidence on the screen that at some point, even though she never realized it, Jane did have an actual heart attack, but her own body came to her rescue.
We're all done.
The verdict?
Thanks, everyone.
While she will need to take medication, she won't need surgery. Good news.
Okay.
Heather Stuckey wants to help people. She's thought about it for years. So one day she gave up her HR job, headed back to school for her doctoral degree, and is now a clinical researcher at Penn State Hershey Medical Center. Right now she's studying the use of social media and how it might help patients both at home and around the world. The subject at hand, diabetes. One she knows all too well. Heather Stuckey has diabetes herself. She and her team have set up a website that not only gives patients information, but encourages them to share their own experiences. For people with diabetes especially, she says the time is now to use every tool at hand.
My hypothesis is that people who are able to get support from people will have less emotional distress, because having diabetes is a tough disease. It's not just one thing. It affects emotions. It affects, of course, the medical side. But my assumption is that diabetes is so difficult for people, and I think that this site will help not only with that social support and saying, here's what I've done, but really also help other people to problem solve and see what others have done to be able to help them.
Kendra Durdock is a diabetes nurse case manager. She says she has seen the benefits of being able to go online to share both daily experiences and practical tips to keep sugar levels in line. And she knows, too, of what she speaks. She was diagnosed with diabetes in 1971.
Diabetes can be a really lonely disease sometimes, and really no one truly understands what you go through except other diabetics. And it used to be that you'd have to go to a support group at a hospital or look up an area support group, which probably only meets once a month, if that. And now with the social media things that are out there, you can get immediate connection with people.
Pending funding, Dr. Stuckey's research is set to go global, bringing together people of many ages, races, and cultures online to help one another. This look into social media is an example of one of the many basic science and clinical research studies being done at Penn State Hershey to treat and cure major diseases. Each year, the research is supported by more than $100 million in funding from government agencies, businesses, and individuals. Ask Krista Laszlo what she wants most in the world, and the answer is one word: baby. After years of trying to conceive, she finally found out why she was having trouble. Newly diagnosed with polycystic ovary syndrome, she entered Dr. Richard LeGros' latest clinical trial at Penn State Hershey, in which patients were given one of two drugs. And that's when Krista and her husband heard what they had been wanting to hear for so long.
I was on a double-blind study, which it was a 50-50 chance I would be on Clomid or I would be on a new medication called letrozole. The study was supposed to be a 5-cycle study through 5 periods, and by cycle 2 I was pregnant. I still to this day do not know what medication I took. I found out I was pregnant in early February, and I had a baby girl named Zoe on October 16th. She's very healthy, no complications during my pregnancy. The baby's perfect. She weighed 6 pounds, 11 ounces, and was 22.5 inches long.
Get your arm in here.
Today is visiting day. Back to Penn State Hershey Women's Health to check in with nurse Jamie Ober, Special Projects Coordinator for PCOS trials here. Baby Zoe Rose will be tracked as part of the study for the next 3 years.
Right. Jamie is awesome. I mean, she has been so helpful. She's been with me throughout the entire study I was on.
It's such a rewarding thing to know that you can take something that someone wants so badly and be a benefit and contribute to that success. And when you first see that baby, you know, little egg and little sac on the screen, and you know the parents have worked so hard to get there. And then obviously when you have baby Zoes, you know, come in here that are nice and healthy, it can't get any better than that.
Oh, my cold hands, I'm sorry. Hi, beautiful. Hi, gorgeous.
Dr. Richard LeGros' various clinical studies are continuing, as is his quest to dig deeper into the syndrome. And it is one that is growing. Polycystic ovary syndrome is now epidemic in India and China. No one really knows why. Today, South Korea is experiencing the lowest birth rate of any developed country in the world. The leading cause of infertility there? You guessed it, PCOS. His work is not only intriguing, but vital as well.
There's nothing more satisfying in life than giving birth and raising children. And I think it's the most important medical mission. And again, I'm biased, because if we don't reproduce, we're gone in a generation. We can cure cancer, but that doesn't maintain us on the planet. So anything that affects reproduction is ultimately of the most importance to us as a species.
After extensive brain surgery to lessen a golf ball-sized tumor and 5.5 weeks in the hospital, 11-year-old Nathan Murphy is back at home. He's just begun going back to school. He's on monthly chemo treatments to continue to shrink his tumor. He's not all that sure about liking math, but he's very certain about one Dr. Mark Diaz.
He's the best doctor I ever had, I think.
No parent wants to hear that their child has a brain tumor, and no parent wants to see the brain surgeon. On the other hand, you develop an incredibly close relationship with them.
We've always had a sense that we're supposed to be there, and they know that, and they want us there, and they feel like they can do the best for our son. So that's a lot of peace of mind right there. The confidence that they portray gives us confidence to keep going back.
Dr. Mark Diaz will tell you he feels gratified and humbled to do the work he does. It is, he says, a life of big wins and big losses, and one where you find the best the human spirit has to offer each and every day.
The children are very uplifting. It's a very positive, enriching experience, and they teach me a lot about how to live life in the face of adversity, because they just keep going.